My name is Dr. Nelly Atieno. I am a psychologist consultant at Restore and Renew Wellness Group. We are based at Luton Hospital, working in collaboration with the main hospital in terms of mental health. As we are all aware, this month is Breast Cancer Awareness Month. And literally, when we're talking about breast cancer, we're talking of ways of coping with the diagnosis and the treatments that are available for the affected. And so for us to be able to understand how to cope, we'll definitely be able to discuss the emotional turmoils that accompany a breast cancer diagnosis. And this includes things like shock, disbelief, and even fear. And the best way to understand the emotional responses that come with diagnosis is to look into the stages of grief. One does not only grieve over death, but to understand that the significance of life changes that come along with death and loss are actually best discussed when we're talking about this. So things like shock and belief, especially at the knowledge of that you're suffering from this, people's initially they struggle with accepting the reality that accompany this diagnosis. It's not an easy thing because it's most of the times is life-threatening, and therefore this leads them to adopt a defense mechanism that is centered on the deny. You want to deny that you're actually going through this, and denials is utilized to probably gain sense of control over the situation. Then this helps us better understand that the state of mind of the individual is in feeling of helplessness. You suddenly have been an okay person, everything going well for you. Then suddenly the news of I've not been feeling very well, and then the news of it's cancer can actually really be a shock. And so most of the times people want to remain in denial. It might not be true. Maybe I need to run a second test just to be sure. Maybe I can just sit on it and wait and see. And then also there's anger. Everybody's angry at themselves and even at the universe. I mean, why me and not the other person, You feel hurt, frustrated, a sense of sadness over the situational outcome of all this. And anger can be projected to self or even to other people, and sometimes even to God. It might help the individual feel like they are more in control in the situations when they begin to operate in this kind of atmosphere. People also at that particular time begin to bargain with themselves. This is like, there's a supreme power that can actually I can depend on to help me cope with this, or it can still be I can pray and it will go away. So these are things that when people are faced with this, they actually deal with. And then they also get to a point of depression and even regret. Like, for example, this mostly involves withdrawal or social isolation after the diagnosis. And people get depressed because literally you're wondering, why me? And how is this going to happen? I mean, how am I going to cope with life in general after all this? So people get totally depressed because you do not have an answer to all these questions that even arise. And then fear settles in and even anxiety. And this occurs due to the concerns of a treatment that can be long-term and also very, very expensive. The individual becomes uncertain of the future, not knowing how they're going to actually deal with this burden that has now come to settle in. So these are some of the emotional turmoils that an individual goes through, especially at the discovery of being diagnosed with cancer.